Hello everyone, and welcome back to our channel. Today, we're going to shed light on a topic that is often left unspoken, but is incredibly important for every woman's health and well-being: how aging affects the vagina. As we journey through life, our bodies undergo numerous changes, and the vaginal area is no exception. Understanding these changes is the first step towards maintaining comfort, health, and a fulfilling life at every stage. My purpose is to break down complex medical topics into clear, respectful, and judgment-free explanations. So, let's start by looking at what happens to the vagina as we get older, from the hormonal shifts to the physical changes that occur. The key driver behind most of these changes is a hormone you've likely heard a lot about: estrogen. Estrogen is a powerhouse hormone, especially for reproductive health. It's responsible for maintaining the health and elasticity of the vaginal tissues, keeping them moist, and ensuring a robust blood supply. During your reproductive years, estrogen levels are high and relatively stable. This keeps the vaginal lining thick, lubricated, and acidic, which helps protect against infections. But as a woman enters her late 30s and 40s, a phase known as perimenopause begins. This is the transition period leading up to menopause, and it's when estrogen levels start to fluctuate and, on average, begin to decline. You might notice some early signs of change during this time. The first things people often experience are subtle shifts in their menstrual cycle, but changes in vaginal health can also start to appear. Then, menopause arrives. Menopause is officially diagnosed after you've gone 12 consecutive months without a menstrual period. For most women, this happens around the age of 51. After menopause, the ovaries stop producing significant amounts of estrogen. This drop in estrogen is the primary reason for the changes we're going to discuss today. The most common and significant change is a condition called vaginal atrophy, also known as genitourinary syndrome of menopause, or GSM. Vaginal atrophy means that the vaginal tissues become thinner, drier, and less elastic. Think of it like a plant that isn't getting enough water. It becomes less plump and more fragile. When the vaginal walls thin, they lose their natural folds and become more susceptible to microtears and irritation. This can lead to a range of symptoms, including vaginal dryness. This is often the first symptom women notice. The natural lubrication that once kept the area moist is no longer as abundant, which can lead to discomfort, itching, and a feeling of burning. Pain during intercourse. The medical term for this is dyspareunia. With less lubrication and elasticity, sex can become uncomfortable or even painful. This can be a significant source of distress, affecting intimacy and relationships. Itching and burning. The thinning, dry tissues are more easily irritated, leading to persistent itching or a burning sensation. Urinary symptoms. The tissues of the urinary tract also depend on estrogen. As a result, many women may experience increased urinary urgency, more frequent urination, or a higher risk of urinary tract infections, UTIs. This is why the condition is called genitourinary syndrome of menopause. It affects both the genital and urinary systems. Beyond the physical discomfort, these changes can have a significant impact on a woman's mental and emotional health. Many women feel embarrassed or ashamed to talk about these issues, leading them to suffer in silence. This is why it's so important to open up this conversation and remove the stigma. Now, you might be thinking, this all sounds quite bleak. Is there anything that can be done? The answer is a resounding yes. The good news is that these symptoms are treatable and manageable. You don't have to simply accept them as an inevitable part of aging. Let's talk about the various ways to address these changes. First, for managing day-to-day dryness and discomfort, there are over-the-counter options. Vaginal moisturizers are designed to be used regularly, not just during sexual activity. They work by rehydrating the tissues and can significantly improve comfort. Think of them like a facial moisturizer for the vagina. Then, there are personal lubricants, which are used specifically to reduce friction and make sexual activity more comfortable. Using a water-based or silicone-based lubricant is often recommended. For more persistent or severe symptoms, medical treatments are highly effective. The most common and effective treatment is local hormone therapy, specifically vaginal estrogen. This can come in various forms, such as vaginal creams. You apply a small amount of cream directly into the vagina. Vaginal rings. A flexible ring is inserted into the vagina and releases a low, steady dose of estrogen over a period of 3 months. Vaginal tablets. These are small tablets inserted with an applicator. The beauty of local vaginal estrogen is that it acts directly on the vaginal tissues, restoring their thickness, elasticity, and lubrication with minimal absorption into the bloodstream. This means it's generally considered safe for most women, including those who may not be candidates for systemic hormone therapy. In some cases, if other treatments haven't been effective or if the symptoms are part of broader menopausal issues like hot flashes, a doctor might discuss systemic hormone therapy, which involves taking estrogen orally, through a patch, or via other methods. Beyond medical interventions, there are also lifestyle factors that can play a role. Maintaining a sexually active life, with or without a partner, is actually beneficial. Regular sexual activity, whether through intercourse or masturbation, increases blood flow to the area, which helps to maintain the health and elasticity of the vaginal tissues. In addition to that, some women find that pelvic floor exercises, also known as Kegel exercises, can be helpful. These exercises strengthen the muscles that support the pelvic organs, which can improve blood flow and overall pelvic health. So, to summarize, the key takeaway is this. Aging brings about changes to the vagina, primarily due to the decline in estrogen. These changes are normal and natural. However, the discomfort and symptoms associated with them are not something you have to live with. There are effective, safe, and readily available treatments. The most important step you can take is to talk to a healthcare provider. A doctor, gynecologist, or nurse practitioner can provide a proper diagnosis, discuss your symptoms openly, and help you find the right treatment plan for you. Remember, your health and comfort are a priority, and there is no need to feel embarrassed or ashamed. Thank you for joining me today. I hope this has been an informative and empowering discussion. Until next time, take care of yourselves and continue to shed light on these unspoken topics.
The menstrual cycle begins with menstruation. Once the bleeding stops, the uterine lining becomes thicker and begins to prepare for the possibility of a pregnancy. Somewhere around day 14, an egg is released from one of the ovaries and begins its journey down the fallopian tubes to the uterus. If sperm are present in the fallopian tube, fertilization can occur. If the egg is not fertilized, the egg breaks down, and hormonal changes signal the uterus to prepare to shed its lining. bringing us back to day 1 of the menstrual cycle. Please watch my next video if you want a more in-depth overview of how menstruation works.